healthcare setback for Somalia. Health correspondent Linord Moudou joins us with the story. Welcome, Linord.
Hello, Vincent. Hello, everyone. Well, although some observers say things are improving in Somalia, the medical relief agency Doctors Without Borders, or Medecins Sans Frontieres, is pulling out of Somalia following a string of attacks on its staff members. It began closing its facilities on Wednesday after 22 years of humanitarian work in the country. The group's international president, Dr. Uni Karunakara, told reporters that conditions in Somalia had become too volatile.
This decision has not been taken lightly. Working continuously in Somalia since 1991, we are very aware of the immense needs that face the Somali people. The closure of our activities is a direct result of extreme attacks on our staff in an environment where armed groups and civilian leaders increasingly support, tolerate, or condone the killing, assaulting, and abducting of humanitarian aid workers.
And the pullout could be a tremendous blow to relief efforts in the Horn of Africa nation. Joining us via Skype from the Netherlands is Arjan Henhenkamp, General Director of Medecins Sans Frontieres in Amsterdam. Welcome to the show, Mr. Henhenkamp.
Thank you very much.
First of all, can you give us a sense of the type of work that MSF has been conducted for the past 22 years in Somalia?
Certainly. We have been working across south-central Somalia as well as Puntland and in Somaliland in at least 14 different locations. This was the last count. With many different health facilities, including hospitals, and we provided healthcare to about 600,000 people in outpatient care across Somalia in 2012, and about 50,000 hospitalizations that we took care of in the course of 2012 for people that required more intensive medical follow-up.
Now, given this recent decision to pull out of the country, what will happen to these patients that were under your care, under MSF's care, and those that need immediate care?
This is one of the heaviest and painful decisions that MSF has had to make, because we consider that in Somalia today, particularly outside of Mogadishu, there continues to be a heavy humanitarian crisis. The population continues to be affected by violence and strife, and there's a lack of health care that is available for the Somali people. So the sad reality is that even though we will try and be as responsible as we can to take care of the patients that we are having in our facility today, there's very little alternative to many of the patients that will come to the MSF clinic once they're being shot. Because the healthcare provision in Somalia is not adequate at the moment.
Now, the Somali government just released a statement saying that it is very saddened by this decision and hope for a review. How do you feel about that? What is your reaction?
Our reaction is that the reasons why we have had to take this very sad decision is a multitude of serious attacks that we have suffered as an organization, as individuals working for the organization since the last few years, which includes abductions and killings and targeted attacks and roadside bombs. And we have noted that the authorities, generally speaking, are either unwilling or unable to help protect us against these attacks or address these attacks effectively after they have occurred. So I would say to the Somali government that this is a part of their responsibility in the areas that they do control, where they exercise control, that they are responsible to create conditions that permit an organization like MSF to continue to work in a place like Somalia without fear of being brutally attacked on a regular basis.
Okay, quickly, in 5 seconds, is this temporary or it's a final decision, a permanent decision?
It's not a permanent decision. Nothing is ever permanent in the world, but it's also not a decision that we've taken very lightly. In fact, we've agonized very hard about it. So we're not going to review it in the very short term, but we are going to monitor the situation, and we're going to look for signs that the Somali leadership, the government, the armed groups alike, are taking seriously their responsibility towards making possible the work of humanitarian organizations like MSF.
Okay, Mr. Henhenkamp, thank you so much for joining us.
Thank you very much.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.